Prairie Parkway, from its inception, was rooted in what can we do as the healthcare provider to make it convenient for access, to improve the quality, to really try to improve care coordination for our patients.
We were looking to focus in on the patient to try to coordinate all of your care in one facility for convenience, also for continuity and consistency.
Here at Prairie Parkway, we house physical therapy, occupational therapy, and speech therapy. We really try to have a comprehensive treatment approach in terms of if a patient needs to have multiple services, we can house those under one roof.
In Prairie Parkway, we have the pediatric specialty care, but also pediatric therapy, speech therapy, occupational and physical therapy, who are right here in this building. We also have lab as well as x-rays in this area, and it's tough when you have a kid and you have multiple siblings or a car seat to carry all that down and go to the lab. So in this facility, we have lab coming over to your room to draw the blood, so you don't have to go to multiple places or multiple stops prior to leaving the building.
Coordinated care means for the patient that they'll be able to get all of their needs done in one spot and hopefully better their health care in the long term.
I think the overwhelming theme as you walk into the building as a whole is the amount of space that they've given us. We've got a walking track that we utilize every day, multiple times a day. In terms of machines, we basically have anything and everything we need to rehabilitate the patients that we have, including an excellent space for pediatric patients.
This new facility, we are able to have a little bit more collaboration with some of the primary care doctors as well as some of the specialties. We are also able to offer you a pharmacy that's open the same hours as urgent care, so patients don't have to drive across town to get a pharmacy if they come in after hours, which is very nice. There's also more comfortable waiting areas. As we all know, urgent care sees a large number of patients, and we want to make sure that you're comfortable while you're waiting to be seen.
I think one thing that sets us apart here at UnityPoint Health Therapy is that we have a one-to-one therapist to patient ratio, which provides a more comprehensive treatment approach, and we can provide better outcomes to the patient for their future.
So in this one great Prairie Parkway building, we have primary care, obstetrician, pediatricians, our urgent care facility, all of those providers now in one space that can truly communicate really hands-on, face-to-face, and better coordinate the care for our patients.
We have implemented a program called Clockwise, and it allows us to better get patients scheduled and roomed and keep track of time and how long waits are. You can also pre-register online through the UnityPoint website and reserve a spot and be able to bypass some of the wait time as well.
So we try to coordinate all appointments. So if there's an appointment that they have with a speech therapist, we try to get the patient in up here to see us for the visit the same day, so you don't have to go to multiple places.
Our aim is to get all of that in one spot, so when they come in, we can do all of those things in kind of a ladder or stair step, so they'll see one person move to the next phase in their care and then be able to walk out with the complete picture rather than fragmented here and there.
The heart of Prairie Parkway experience for the provider team is that co-location. So the provider, the physician, sits directly with the rest of the team, both nurses, the scheduler. That allows us to do decision-making, problem-solving at the time of service. Not only are patients happier that we're answering those questions when the call comes in, but now the team is also more satisfied.
One philosophy we have here at Prairie Parkway is the best tools that we have lie within the therapists, in their minds and their hands. And we really bring that to work every day.
To really deliver the care that the patient wants, to deliver the care that's important to the family. We do that both in Prairie Parkway, but you know what, that also involves our community, that we're getting out into the patient's home. It involves our hospital. It involves all the other access points that we have to have access to care.